Got a question today from a patient who went through the program and got better, and they said, will my herniated disc come back? I think this is a great question, super important. I get this question all the time. I want to help you better understand what you can expect for outcomes with our therapy. Again, this is all about outcomes. So today, we're going to talk about sciatica treatment results of a 40-year-old male. This is case study number 70. And now we're up to 835 case studies. Again, the goal is 1,000 before the end of January. So we do this because doctors are not obligated to publish their outcomes. People don't know what to expect with very specific types of treatments. So we want to help you better understand what you can expect for outcomes from different therapies. We talked about our program, comparing it to surgery. We talked about that Friday. If you want to see that video, go find that video. It's a great video. It talks about the two outcomes. But our goal is to help you make better decisions. And the way you make better decisions is you know what the problem is and what you can expect for outcomes from a specific type of therapy. Today we're talking about the herniated disc, because this is about, is the herniated disc going to come back, which is the question that we get. So the herniated disc looks like this. The nucleus on the inside. Nucleus pushes out to the outside and pinches the nerve. We have a video on what is the herniated disc. You can watch that. But we also have one that talks a little bit more about our therapy and the benefit to the herniated disc as a result of the therapy. But this is what we're talking about today. We're talking about the herniated disc pushing on the nerves. So the herniated disc will be in this space right here, pushing on the nerve, causing the sciatica. Question is, will it come back after our treatment, assuming you get better? So 40-year-old male, back pain and sciatica for 1 month. Pretty severe pain when he came in to see us. Before he saw us, he went to 2 other doctors and he had an MRI. He had injections directly into his spine, the cortisone injections, had seen a chiropractor and was taking medication, all in that 30-day period before he came to see us. Was not getting any better. Matter of fact, was getting worse as a result of those treatments. Came in to see us, happens all the time. Patients go through therapy and don't get better, and then they come to see us. So you know that the outcome for these therapies for this patient were not good for his condition. His condition was a herniated disc. We have a 9-step sciatica solution. Oh, Happy New Year, everybody. 9-step sciatica solution. Part of the solution is knowing what is causing your sciatica. So there's an educational piece. There are tips that we educate you on, and we're going to do some more of those tomorrow, Tuesday. Tuesday is Tip Tuesday, so we'll get that tomorrow. It's about how to sit, how to bend, how to twist, how to move, how to do all those things. And then part of our goal for our 9-step solution is identify what is pinching the nerve, what is causing the irritation to the sciatic nerve. So we do what's called functional disc evaluation. We evaluate the disc by having you do certain motions, and we take an MRI and do all these things, and we want to identify exactly what's pinching that nerve. So in his case, put him through the MRI program, identify what was going on, and here's what we found. We found a herniated disc, bulging disc, stenosis, and sciatica. Now there are typical 5 reasons that you can have sciatica. He had 3 of the 5. Okay, they're kind of all connected. They're kind of, it's not common when you have one that you have more than one. In his case, he had 3. Some people have 5. Some people have 4. Pretty straightforward. But he had pinching of that nerve as it came out of the low back down the leg. Okay, that's sciatica. Sciatica starts here, gets pinched, goes down here. He had sciatica. Okay, pinching of the nerve. We talked about that. The herniated disc right here. That disc will pinch that nerve as it exits the spine. So our goal is to treat that disc. And we have a process to treat that disc. But he also had a bulging disc, which is a sort of a smaller version of the herniated, maybe a little bit broader on the outside, but it's a smaller version. But it will compromise and pinch that nerve, and he had stenosis. Stenosis is a wear and tear to the spine, and the wear and tear typically is a result of slow breakdown. It's called a degenerative cascade. Once the process starts, the longer you have it, okay, the worse it gets. Now, he may have had an injury a while ago that caused that, but in the end, we know he's got a pinching of a nerve from a bulging disc, a herniated disc, and the stenosis, all in his lumbar spine. Our goal with our therapy is to take pressure off the disc. So what we do is we slowly take pressure off. You wear a harness, and the harness takes the weight off the disc. We sort of lift you up a little bit. It doesn't hurt. We're not trying to pull you apart. We're just doing what's called unweighting. And the unweighting process allows for the nucleus to slowly move back to the inside. And as it slowly moves back to the inside, and we know exactly how to do it as a result of our evaluation and our MRI, which is part of the 9 steps, and then we reactivate all the muscles that hold it together. So we're taking pressure off, reactivating the muscles, taking pressure off, reactivating the muscles. And what happens is you slowly start to get better. So when this patient came in to see us, again, he had gone through chiropractic, was taking pain meds, and had a couple injections, cortisone injections. His pain was a 10. Okay, it doesn't get any higher than that. That's a scale of 1 to 10. His Oswestry Disability Index was an 84. That's about as high as you can get too, okay? He was barely getting out of bed when he came to see us. Now, technically anything above 80 is bedridden, but he was in serious pain, and nothing was getting him better. Absolutely nothing was getting him better, okay? So he had an Oswestry Disability Index of 84, went through 33 treatments. Doesn't take a week, doesn't take a month, takes 3 months. But you'll know after the first couple of weeks that it's really starting to feel better. Within a month, you'll feel a lot better. Okay, you're not going to be better in a month, take some time. But at the end of his 33 treatments, his back pain was a 0. His sciatica was a 0. And his Oswestry Disability was a 0. Now again, there are 5 categories for the Oswestry Disability Index. The Oswestry Disability Index is the indicator of how much disability you have as a result of your back pain. His was about as high as you can get. He was a candidate for surgery. Okay, another week of him not getting any better, he definitely would have had surgery because he was in so much pain. Now, 2 years after our therapy, we followed up with him. We said, how are you feeling? What's your level of disability? We had to fill out the 10-question questionnaire. Okay, the Oswestry Disability Index is a 10-question questionnaire. 2 years after our treatment for his severe herniated disc that was compromising his sciatic nerve, causing his sciatica, his back pain and his sciatica were still gone, and he had 0 disability. 0. So what does that mean? It means when you go through the program and you get better, which is all back to our 9-step process here. Okay? When you go through the program and you get better, we have a completion of care where we give you really simple exercises to do when you're at home. Doesn't hurt. Simple, very simple things. If you go through the program, you do the exercises, you're committed to the program while you're in it, and we teach you the things that we need to teach you because it's about teaching you what you need to know. When you get to the end of the program, you start to feel better, and 2 years later, you're out of pain. It doesn't take 2 years, it takes 3 months. But by the end of it, you're completely out of pain. And 2 years later, the hernia disc did not come back. So the question was today, if I get the treatment, or after I'm done with the treatment, is my herniated disc going to come back? If we've done our job and we've stabilized your spine, it's not going to come back. This is what it looks like. Herniated disc. This is an MRI. Nucleus pushing into the spinal canal. Okay? That's what this is right here. This is the herniated disc. Okay? We're seeing this disc. Technically the person's facing this way, but what we're seeing is this disc right here in the spinal canal. That's what this is right here. Went through the program. At the end of the program, herniated disc completely went away on this particular patient. Completely went away. Go through the program, disc gets better, you do the exercises, doesn't come back. Okay, so you can live the rest of your life without any problems. A couple things. Number one, it's New Year's. So again, Happy New Year to everybody. But if you have back pain or you have sciatica that's not getting better, you need to make an appointment. And we're going to put a link right above, and we're going to put a link right below, and you can click on that link to make an appointment if you're not getting better. If you have back pain that's not going away, we can help you. Number two, if you don't have back pain, but somebody you know or somebody you love has back pain, you forward this to them or you share this with them so they know that they have options. This is all about now you have options. You have options you didn't know existed. We do something different. Quite frankly, what we do is better. It's better for severe problems because you can get better without the drugs or without the surgery. We don't do any drugs or any surgery in our clinics. Okay, you don't need the medicine or the surgery when you go through our program. So share with your friends and family. Like us on Facebook and subscribe to our channel on YouTube. Again, herniated discs will go away, and if you do it right, they won't come back. If you have a herniated disc that keeps coming back, then you need to come see us. That's what we do.